Dr. Manny Alvarez with us now in studio. And Manny, you live and work in New Jersey, and you've been in touch with a lot of folks on the medical side. What do you want to share with us so far about the injuries and possibly others?
Well, Hoboken is a town that I live in partially also, so I'm very familiar. Early this morning when the accident happened, basically the regional hospitals that serve Hoboken are hospitals that I'm part of. Immediately a command center was placed at Hackensack University Medical Center, which is the main trauma center to receive trauma victims. Right now, most of the injuries are going to places like Jersey City Medical Center, Palisade, and St. Mary's hospitals, and depending on the severity of the injuries, some patients might get transported to Hackensack for more intensive work. Early this morning, I did confirm before it was officially announced that there was one mortality, allegedly a patient on platform, but most of the injuries that we're going to see basically probably are going to be referred to the first, second, and third car, because that's where the impact energy of a full stop going into a, almost like a car crash, hitting a tree, if you will. There's going to be a lot of cuts and a lot of broken bones and a lot of internal bleeding. Those perhaps are the types of injuries that the initial PR person was alluding to as far as critical patients that require intensive help. But this is still, we still don't have the full picture on the severity of the injuries that are going to come out of this.
I would imagine the people that were standing were at greater risk than those that were sitting, or I don't know. What do you think? Well,
anybody who rides a train, especially these types of transit trains, they all have hard surfaces. It's just all metal, right? There's no cushion of any kind. And when you compound that with, with a lot of bodies that stand up typically with a full force of the energy that you get thrown, you either hit another person or most likely you hit a very hard surface, because those are very hard plastic seats and metal rods everywhere, so you're bound to have significant types of injuries once that happens.
We had an eyewitness, Manny, just about 20 minutes ago describing head injuries, a lot of cuts to faces and eyes, etc. That goes along the line of what you're describing to us now.
Yeah, and you have to remember, not because you're bleeding from the outside doesn't mean that there's no injuries. When you have these impact injuries, you could hit your head so intensely that you start bleeding intracranially, and you're going to need an emergency operation to release the blood. The same thing happens in the thorax. You hit your chest so hard that your lungs, your spleen can bleed, not necessarily showing that you have a cut from the outside. So this is why these injuries get so problematic for the first responders, because they have to triage right there at the scene, whether they're dealing with a crushing injury with internal bleeding, and then those folks have to be rushed immediately, and immediate resuscitation has to occur.
I mean, based on what you were saying, we saw a lot of people that walked away. A bunch of them talked to us. What would you say they should be looking out for in themselves, even though they walked away? Well,
I think there's going to be, hopefully, despite the fact that people walked away and they were involved and were in the train or in the platform, but they don't seem to be hurt, there's going to be sort of a follow-up. Usually there's an accountability for the people that were there, just so that other health professionals can follow up and make sure that they don't have any subsequent injuries that could develop in 12 to 24 hours.
Manny, when you look at this and you see the massive response from the first responders, how often for a situation like this would they drill or would they practice, and what would be the level of preparedness?
Well, I can tell you from the healthcare perspective, since 9/11, all regional hospitals, we in Hackensack definitely do that because we are a major trauma center. We have drills constantly because these things happen, and within minutes you have to be able to set up your command center, and you have to get all the key leaders from nursing and ambulance services, EMT, and also surgeons to be readily available. So in the New York tri-state area, most hospitals practice this on an ongoing basis because you never know. We live in a world where there's a lot of uncertainty. Hopefully this is an accident and nothing more than that, but we have to be prepared. So from the healthcare perspective, this gets practiced every single time, maybe 2 or 3 times a year, just as the police and the first responders have also these types of emergency trials, because nowadays we have to be ready no matter what.
Manny, great work. Thank you. Manny Alvarez, our doctor here in charge today on this story, lives and works in New Jersey and knows this past station well, and one of the first to call in our newsroom about an hour ago about the first fatality, and hopefully that number stays exactly where it is from this point forward. Thank you, Manny. Good to have you.